Hello, I am Javarius, and the concept that I am going to focus on today is prioritization. Prioritization is deciding which health problem or needs to be addressed first. That could be life threatening. If it's nothing life threatening, where do you go from there? And also, with prioritization, you can also include delegation into that. For certain things that needs to be done, you could, hey, I need to attend to this patient right here, right now. Can you go do this? Like, oh, this patient has a urine sample. Can you go get this urine sample while I go get this patient pain medication? When it comes to prioritization, there are three levels. The first level we learned from day one in nursing school is airway, breathing, and circulation, vital signs, and labs. Airway is the airway painting. It's the patient able to take in air and breathe out air to sustain life, because without the airway, sensation of life happens very quickly. Breathing is talking about the lungs. It's the lungs, it's the oxygen exchange at the alveoli existing. If that's not existing, patients have decreased oxygen to their organs, which can cause other problems. Circulation, we read about, is their blood perfusing to all the organs like it needs to. Like if their heart's pumping, but there's no blood getting to the brain because it's occluded by fat. Well, a clot. It's a clog. Atherosclerosis from the heart to the brain, and that can cause a stroke. Same with the lower extremities. If you end up with a deep vein thrombosis, that deep vein thrombosis can lead to a pulmonary embolism because that clot, a piece of that clot could break off from the DVT and get to the lungs. Next, you want to talk about vital signs. When it comes to vital signs, you want to look at how extreme are these vital signs that it could cause immediate danger. Like if you have someone who has a blood pressure of 250 over 180, that needs to be seen right away because that is some would consider a stroke level blood pressure. A heart rate that is above 200 or below, let me say 50, needs to be addressed right away because that could, the supraventricular tachycardia could lead to the heart failing very fast because the heart's going to get tired very quickly. The low heart rate, not really necessary like a priority, but it's something that you want to look at just in case, like why is it getting too low? Or if it's low, is it sustained at like 40 beats per minute? Next is laboratory values. The laboratory values that we're mainly focused on are laboratory values that affect the heart and lung, like your ABGs, your potassium, and your calcium. Those you want to look at because I know when it comes to ABGs, you want to see, it's serious about to happen. The next level of prioritization, the second level, is untreated medical problems, acute pain, elimination, safety. It's all about safety in the next level. When it comes to safety, after your airway, breathing, circulation, your extreme vital signs, and your labs pertaining to the heart and lungs, you want to look at level of consciousness. Someone has an altered level of consciousness becomes a big safety risk. It's a safety risk that trumps pain. This patients, if they're, passes out immediately, they can hit the floor and cause additional injury. That's why a level of consciousness is considered right after ABC circulation, those extreme vital signs and lab values, because it can cause additional injury when these changes in levels of consciousness happens. And usually when you're talking about changes of level of consciousness, we're talking about the decreased level of consciousness. Untreated medical problems like infection. If the infection is not treated like it needs to be, that infection should kind of tie right back into vital signs because for sepsis, which needs to be treated ASAP, usually you're going to have 2 out of 4 vital signs that are off. Like you're going to have a high temperature, high heart rate, low blood pressure, and possibly high respiration. So when you see that all this is starting to happen, you're going to start thinking sepsis/infection. You want to get that infection treated as soon as possible. And then we're going into acute pain. The pain, Jacob says we have to treat pain. And also elimination problems. Say for instance you have a patient that's trying to use the restroom, but they can't really walk. Well, when urgency kicks in and they're not going to the restroom fast enough, if they're not making it to the restroom fast enough, that can propose as a safety risk. Because they're going to attempt to get up out of bed and make it some way to use the restroom without your help if you don't get there like you need to. But also, elimination is one of those needs that can be delegated to an unlicensed assistive personnel or OPN. Imminent risk. Imminent risk is hard to define. And the last level of consciousness is not really those that are included in 1 or 2, but it's like your everyday routine care, like providing patient education, doing your safety rounds, make sure your patients are okay, are your patients resting when it's time to rest, if there's barriers hindering them resting, what are those barriers that are hindering them from resting? You want to focus on, like, once they get discharged, their environment at home. Is it safe for them to go home? If it's not safe, that might be something you want to consult the social worker on. Because if one of the problems that brought them into the hospital in the first place, or to receive care in the first place, if it has to do with their home environment, we need to look into that home environment. Also, that can be considered in the 3rd level is discharge. Discharge is like one of the last things on your list because that patient is stable enough to go home. You can always see them last. And also in this 3rd level, you want to focus on Maslow's hierarchies of needs. That can kind of help you prioritize, because the further side of airway, breathing, circulation, those vital signs and labs. Next, we're going to the Maslow's hierarchy of needs that can help you prioritize care. Thank you. That is the end of my presentation.